Okay, for recording. And if you've tried to pull up quiz 5 before now, gotta wait another minute before it becomes available. You'll have to refresh. Okay. Okay. We still have a few more students, but it is 3 o'clock, so let's get started. Okay, so today we have a couple of weeks of content to cover, week 7 and week 8. Okay, and we'll start class by doing quiz 5. Okay, and then we'll review quiz 5. Do some of the content for the concepts in the quiz. It covers quite a bit. And then we'll review all the different concepts covered in the last 2 weeks. Okay, how does that sound? Okay, and I need to look at my calendar. Is next Monday already Labor Day? Yeah, next Monday's Labor Day, so we don't have class next Monday, right? No class. And we go a little bit extra every class to make up for the missed class. So you don't have to attend any other sections or anything next week. So next week we do not have class. Okay. Exam 2 grades were posted over the weekend. Congratulations. For the most part, this class did really, really well. I'm very proud of you. Very proud of you. Still didn't have a whole lot of attendance at the reviews. I'm hoping that you were watching the recordings. Is that what you were doing? Okay, were the recordings helpful?
Yes, I attended someone else's on
Okay,
Sunday night. Yeah, so and then I try to do the reviews, watch the ones that are posted.
okay,
Yeah.
fantastic. Are the reviews helpful?
Oh, yes.
Okay. And I know I always ask this question, but are the weekly concept recordings helpful as you're getting prepared to take quizzes?
Yes.
This is the first term we've done weekly concept recordings. So hopefully they're helpful. The other thing about along with exam 2 grades being turned off, if you read the announcement, or exam 2 grades being posted, homework grades are off. So that means what you see is your true KGA going into week 8, which is drop week. This is drop week. So if anybody has any concerns, and you're thinking about dropping, schedule a meeting with me and let's talk about it. I'm not a fan of dropping, but we can talk about it. Okay. Does anybody have any questions? This upcoming week, for week 9 for next week, I know you don't have class, but you'll get a pretty extensive announcement, and I call it a roadmap. Once we get to week 9, I send a roadmap announcement that goes through what we're doing in week 9 and what's due in week 10, and what's due in week 11. The other thing I hope to get this week is the starting schedule of HESIs. Okay, there's a master schedule of HESIs that I have access to. We all have access to, faculty, and a lot of campuses have already scheduled when their HESIs are for community. All right, so I hope to get that master calendar to you sometime by the end of the week with whatever's available. We have lots of campuses in this particular section. So I'll see what I can do. I'll see what I can get together for you. And it's more to plan ahead. I mean, you schedule your HESIs through campus, or excuse me, yeah, through your campus, right? But it's more to just to give you a heads up of when your community HESI would be scheduled for during the week of HESIs in week 12. Okay. Anybody have any questions about anything? Okay. All right. So why don't you pull up quiz 5? You have to refresh it if you tried to do it before 3 o'clock. Wasn't available till 3. Okay. Let's see, it's 3:05 now. 20 minutes, 15 minutes, then accommodations. So go ahead. We'll be back here at 3:25. Okay. The access code is my last name, which I just put in the chat. Okay. It should be open and ready to go. Can you guys see it and get into it? Yes. Great. All right. I'm going to mute myself and we'll see you in 20 minutes. Okay. And if you're finished, hit submit before you go off camera, please. Okay, it looks like everybody's done. So if everybody could start coming back on camera, that'd be great. How'd you do? A lot of infection control. Okay, let's wait for the rest of the group. Indira, Janet, Claudia, Adriana, could you go, and Jaquetta, come on camera? We'll get started. Okay, if everybody can come on camera, then we can get started reviewing the quiz. Thank you. Can everybody see my screen? Can anybody see my screen?
Yes, we can see it.
Oh, thank you. Okay, thanks. All right. As you can see, a lot of these quiz questions were, a lot of it is infection control, which is super important. So let's start going through them. Again, I provided you rationales. Hopefully they're helpful. Did you guys look at your rationales from quizzes 3 and 4 for the
Yes.
exam? And did it help to review those?
Mm-hmm.
Because there's a lot of content material in those rationales. All right, so which of the following are effective parts of infection control to reduce the incidence of hospital-associated or healthcare-associated infections? Select all that apply. Well, we certainly know that proper use of protective PPE is important, hand hygiene. And then the environmental, whatever your organization's environmental infection control guidelines are, measures. Okay. There's no need to explain the procedure before starting. So let's have a look at the rationale here. So we know that healthcare associate, and have you heard this in other classes? Have you gone through infection control and med surge?
In foundation?
Foundations, great. All right, so healthcare associated infections are infections that patients get while or shortly after receiving healthcare. To prevent these kind of infections, we can use a variety of procedures and policies, including hand hygiene, right? We know that all staff and patients should wash their hands frequently and correctly. PPE, gloves, masks, gowns, goggles, face shields as appropriate, right? An example, new gloves should be used for each patient and disposed of after each interaction. Pretty basic. Aseptic technique. Follow standard sterile techniques when performing surgery, caring of wounds, or inserting or caring for medical devices. Environmental infection control, keeping the healthcare environment and equipment clean, disinfecting surfaces, and floors regularly. So that's a really good summary of some prevention activities for healthcare associated infections, HAIs. Okay. In addition to observing standard precautions for a client with primary TB, the nurse should also observe which of the following precautions. Did everybody get this correct?
Yes.
Know that airborne precautions are really standard protocol for patients with primary TB, right? And I gave you in the rationale a summary of transmission-based precautions. So we use standard precautions for all patients, right? Airborne precautions are particularly used measles, varicella, TB. And what's that special mask?
The
The
N95.
N95s, right. Droplet precautions are another type of transmission-based precautions. Droplet precautions are used for patients with meningitis, pneumonia, diphtheria. And then we have contact precautions. Okay, GI, they're used for GI, skin, wound infections, RSV, herpes. So there's a nice summary of different kinds of precautions that are used for transmission-based infections. Airborne precautions requires which of the following precautions? Okay, so we're talking about an N95, which you said, a private room, and we don't want the patient wandering around out and about in public all the time, right? Right? The patient should leave the room only for essential activities with a mask. Here's a summary of airborne precautions in specifically airborne precautions. So according to the CDC, airborne precautions prevent transmission of infectious agents that remain infectious over long distances of time when suspended in the air. Right? We use airborne in addition to standard, right? For patients that we know are suspected serious illnesses transmitted by airborne droplet nuclei. Right? So the preferred placement of these patients is in an airborne infection isolation room that is equipped with special air handling and ventilation capacity, right? N95, which we talk about. Then the patient should only leave the room for essential activities. And there are some examples. Okay, which of the following medical asepsis principles are sufficient for in the home, specifically contact precautions? Did you guys get this right? You should know this one for sure. Gloves, and then know how to dispose. We should know that disposing soil contents in a securely tight plastic bag. Right, and then obviously frequent hand hygiene. There's no need to change our clothes often if we're doing the other three, correct? All right, so here your rationale is a review of what contact precautions are. All right, there are a set of safeguards used by healthcare professionals to prevent the transmission of infectious agents that are transmitted by direct or indirect contact with the healthcare environment. Right? We know that contact precautions are used in addition to standard precautions to protect against the transmission. So here's some examples of illnesses that might require contact precautions: stool incontinence, draining wounds, uncontrolled secretions, pressure ulcers, generalized rash, ostomy tubes, ostomy bags, infections with organisms that are transmitted fecal orally, such as C. diff, wound and skin infections, and then MRSA. Okay. Hopefully a lot of this is a review for you, but it's a good review. So remember I told you at the beginning, this class brings a lot of med-surg information to it because you may be caring for a client in the clinical setting with MRSA or C. diff or some kind of infectious disease, but you're also going to be caring for clients in the home. Right? Not everybody with MRSA is in the hospital or C. diff is in the hospital. This is why this information is so important in this class, because it's providing these kinds of precautions in the community setting. Okay. Okay, Sarah, the nurse, knows that the client needs to understand that the HIV test cannot identify infections that may have been acquired within the previous 3 months before the test. Which of the following statements by the client indicates that further teaching is needed? So based on that information, what is the client going to say that you're going to have to re-educate, reteach, clarify? Does everybody understand why
Yes.
C is correct?
Yes, ma'am.
Because the client is saying the opposite of that, right? The test would be valid. No, that's not true, right? That's why we have to retest in 3 months, right?
Mhm.
So the client needs to understand that the HIV test cannot identify infections that have been acquired within the previous 3 months before the test, right? And the importance of that is that the appearance of the HIV antibody can take up to 12 weeks to show, right? The test might be negative now, but positive in 3 months, right? And I thought this was a good, I took this from the book. Bloodborne infection spread through sexual contact, sharing of needles, and vertically through, say, breast milk, pregnancy. Okay. Used to be spread through blood transfusion, blood is now. Or do you remember the days when blood wasn't tested for the HIV? Right? It now is. Let's say you have a needle stick. What do? You have to go for testing, right?
Mhm.
Right? So after a needle stick injury or high risk exposure or post exposure, prophylaxis is very effective at preventing HIV. Right? The other sexually transmitted diseases that are high risk for HIV due to traumatized tissue include chlamydia, syphilis, herpes, gonorrhea. We know that open lesions and inflamed tissue increase the risk of HIV. Right? And we have to retest in 3 months. Okay, disaster question. Natural disasters can be devastating to a community. The nurse is providing yearly education class to the community. Which statement by one of the community members indicates further teaching is required? And this information was in your book. Okay, so this was a question about, well, obviously you know it's water because all the answers have water in it. All right. A is incorrect because it requires more than boiling. B is incorrect because it requires more than household bleach. Okay, C is incorrect because or D is incorrect because that alone does not render water safe. It's a combination of all of them, which is why C is correct. Okay. And the
Professor.
rationale is, oh, go ahead.
Oh, I'm thinking it's saying, this is a negative question. So it's saying which statement indicates further teaching. And it looks like all the other ones are correct, but the further teaching
Oh,
answer.
shoot. You are correct. Which statement by one of the community members indicates further water can be rendered sit for 24 hours per. Oh, no. This is this is correct. Water can
Oh,
be read. So A is correct, B is correct, D is
right,
correct, meaning,
right. That's what I was saying.
yeah, I'm sorry. I'm explaining this wrong. C is the correct answer because
Right,
we don't allow water to sit for 24 hours pouring water through layers of cotton towels.
right,
That's not going to render water safe to drink.
right.
But a combination of A, B, and D will. Thanks, Janet, for making me
welcome.
clarify that. right? So C is incorrect. We don't pour water through layers of cotton towels. Okay, so the rationale brings all of the A, B, and D together. Okay, water can be rendered safe for drinking by boiling, specifically for 3 to 5 minutes, treating with household bleach. You would add 1 ml or 16 drops per gallon, that should say per gallon, and let stand for 30 minutes. And then definitely removing hot water heat, removing the water from hot heaters and removing the water from commode tanks. Okay, allowing the water to sit for 24 hours or pouring water through layers of cotton towels does not adequately render the water safe to drink. Does that make sense? In the long way I just explained it. So let me rephrase. A is correct partly. B is correct partly. D is correct partly. Right? And if you put all those three together, you get the rationale. Okay, this is a bioterrorism question. The lesions of what can be found on the palms of the hands and the soles on the feet?
Smallpox.
Correct. Correct. Chicken pox, we often talk about the similarities of chicken pox and smallpox. The difference is lesions from chicken pox are not on the palms of the hands or soles of the feet. Okay? And the rationale gives you a little bit more information about smallpox. Starts with flu-like symptoms, then develops into a rash with red spots that become deep pustules. They actually leave craters. Okay, chicken pox starts with a rash, small red dots, turns into small blisters. There's a difference between blisters and craters. Lesions on smallpox can be found on the palms of the hands, soles of the feet. Chickenpox, they do not appear in these two places. Okay. Which actions by the nurse accurately indicate understanding of proper management for a client that has been exposed to a toxic chemical spill? Select all that apply. So all of these are correct. We should know that clothing and contact lenses are considered contaminated, should be removed or discarded. We know the best way to remove clothing is to use tongs. We know that eyes should be irrigated for 10 to 15 minutes. And we know that clothing should be placed in a bag for disposal. Those are all proper guidelines for a potential or exposed to a toxic spill. Okay? So the rationale just restates all of those 4 answers. Okay, this has to do with home health. Okay, the sharing of information from one healthcare setting or provider to another is critical for community-based care, meaning you're taking care of now a client in the community, right? Especially as the clients make the transition between hospital and home, which is an example of this. Does everybody understand why C is the correct answer? Okay, A is incorrect. We're not even talking about emergency room staff. The client is in the hospital. Okay, medical surgical unit and post-surgery staff, that doesn't make sense. We're talking about the transition from hospital to home. Okay, so C, communication between the acute care and home health staff is paramount. Right, the receiving home health agency needs to know exactly what the client's needs are, right? So we know that interdisciplinary communication is required in the home health setting. Okay, interdisciplinary communication does not conflict with the concept of providing direct patient care services. The sharing of information from one healthcare setting or provided to another is critical for community-based care. Right? How else are you going to know? How is the home health nurse going to know what the needs of the client are if there's not interdisciplinary communication? Are there services needed? Is there an aid needed? Is there medical equipment needed? And is that medical equipment there when the patient gets home? That's all the interdisciplinary communication that takes place during that transition. The next question is about abuse and neglect. Physical neglect refers to the failure to provide adequate food, clothing, shelter, hygiene, and or medical care. Okay, A is a silly answer. C doesn't make sense, and D doesn't make sense. Right? So physical neglect occurs when a parent or guardian or custodian fails to provide for the child's basic needs. Basic needs are considered food, clothing, shelter, education, medical care, or supervision. Okay? Questions on any of those? Was it a good review? Okay. I'm going to pull up my concept notes because we have so much content to cover. I'm going to cover it with my notes. Can everybody see my notes? We're going to review these notes. Okay,
Yes,
so
we can see it.
thank you. So week 7, we covered infectious disease prevention and control. We talked a lot about that in the quiz rationales. HIV, TB, and STDs. We did touch upon that a little bit. And we had a question about bioterrorism and disaster. So what do we want to know about infectious disease prevention and control? Okay, let's think about the environment as a whole. Okay, the environment refers to the physical environment, biologic environment, social and cultural factors that are all external to the host. Okay, the host is us, and we'll talk about that in a minute. Right? So these environmental factors facilitate the transmission of infectious diseases, right? From maybe one host to another host. Okay, so here's where the epidemiological triangle comes in. When we're talking about infectious disease, we think epidemiological triangle. So there's 3 parts to that. There's the host, the agent, and the environment. Let's talk about the agent first. Your book does an excellent job of explaining this. There's a good chart in the chapter, the infectious disease chapter, that goes through agent, host, and environment and lists examples of each. And I've pulled out some of that information in my notes. Okay, so the agent is what? What's the agent?
The infection or the disease.
Which can be what? Bacteria. What else? Virus, fungus, chemical exposure. Could be any one of those. Okay, it's whatever. It could be COVID, could be influenza, could be chickenpox, it's whatever the agent is. Okay. The host is us, the living organism. The agent infects the host. So COVID infects us. Okay. So we have to think about the host. Is the host healthy? Is the host unhealthy? Is the host immunocompromised? Does the host have health disparities? Do they have other comorbidities? What's their age? What's their gender? What's their ethnicity? All those play into how this agent is going to infect you or your client. Okay? Then you have the environment. Where is this happening? Is this a long-term care facility? Is this an assisted living? Is this a school? Is this at home? What's the environmental factors and how do they affect it? Okay, so you have to have all three. All three are considered in this transmission. So let's just use COVID, for example. Okay, let's think of COVID as the agent. Let's do a couple of hosts. Let's do one host that are elderly, living in a memory home, assisted living home. Okay? They are going to be much more at risk, correct? Because of their environment and their age. Let's take COVID infecting a high school, or a few kids in a high school. Kids are healthy, have strong immune systems. They may be less likely to get sick from that agent.
They're more mobile.
They're more mobile. Yep. So there's many different scenarios that can play out from a certain agent to a host to the environment. Many factors are included in all three. Right? Let's say you have influenza. Okay? And let's say the host has got their flu shot and they get influenza and they live in their home. Well, based on the fact that they got a flu shot, hopefully the influenza won't affect them as dramatically as others who didn't get a flu shot. So everything's variable. The severity of the agent is important. The health of the host is important. And the stability of the environment is important. Does that make sense? Sometimes that's hard to grasp, but I'm trying to explain it to you in simple terms. You have different kinds of immunity and how it's passed. Passive immunity. It's immunity from someone else, either from a mother or from an IV administered antibodies, right? We were considered, once we are a vaccine, right? So we were considered to have passive immunity when we got our COVID vaccines, right? Herd immunity is, well, that was pretty much the COVID vaccine. The immunity of a population, large group of people being protected from a certain, they would talk after the vaccine, they were talking how long is it going to take for us to get to herd immunity, where the population is immunized. Okay, what's an incubation period? Right, it's a time interval between invasion of the agent and the first signs and symptoms. We talk about incubation period a lot when we talk about chickenpox. Right, you may be exposed, but don't show signs and symptoms for up to 2 weeks. Right? Couple of terminology, a couple of words when we talk about infectious disease, we talk about epidemic, we talk about endemic. Okay, epidemic means that the frequency of the occurrence is in excess of what we expected. That's why COVID was an epidemic. In one of my schools, we had several preschoolers at the same time with chickenpox, way more than expected. That became an epidemic. Okay, sometimes an epidemic is also called an outbreak. Okay, endemic. I think we have moved COVID now into the endemic state, which means it's always going to be here. Think of the flu. Okay, endemic levels of disease or an event provide a baseline for establishing a public health problem. That's the fancy way of saying endemic means it's not going away. It's always going to be around. Okay. Proper hand hygiene. We talked about that in our quiz review. Single most important aspect of medical asepsis and infection control. We already talked about contact precautions. That's in this paragraph right here. Requirements for disease reporting. Every state, well, starting at the federal level, going all the way down to the state level, to the local level, there are requirements for reporting of infectious disease. Yeah, I had a manual in the schools of what I need to report. There's very specific infectious diseases that have to be reported. Okay, it's a mandate. The list of reportable diseases varies by state, but there is a common thread. Okay, states may make additional requirements, but there is a common list. That's federal law, right? State departments, state health departments on a voluntary basis report diseases to the CDC. Okay, if you can look on the website, you can look on the CDC website and get all this information. What infectious diseases are reportable? And what I simply want you to know, I don't need you to know the list of what's reportable, but knowing that it is mandatory to report certain kinds of infectious diseases. One of the things as community nurses you will be involved with is surveillance and observation of outbreaks in the community.
The wide-tooth comb, that's what I use on my boyfriend. So y'all get really excited when I post the videos of him. And you
Oh. Okay, mute Sharice. Sharice is muted. Okay,
I'm sorry. My
That's
husband
all
was
right.
talking to me. What happened?
I had to mute you. You came off mute. We were listening to your conversation.
Sorry.
That's all right. No problem. All right, so observation and surveillance. Okay, so think about it. Let's say we're moving towards an outbreak or there's concern. What are we going to be doing? We are going to surveillance. We're going to be collecting data, analyzing the data, interpreting the data, and then disseminating whatever health information we need to get out to the public to monitor disease trends. Right? We need to be able to communicate what access to resources do people have? Just think of COVID. If you think of COVID through this discussion, it will make a lot more sense, right? So when COVID was present, we were getting resources to access for vaccines, right? Rapid response to testing. Okay. It's all about controlling the spread of the disease. Okay. We have certain patterns of occurrence of the way diseases happen, and I have them highlighted here. We have a point source. I want you to know the difference in these next two paragraphs. Okay. First is different kinds of outbreaks. Point source outbreak. Okay, that's when everybody is exposed to the same thing at the same time. Everybody's going to get ill. Let's say that's a gas leak on a subway. Everybody's exposed to gas at the same time. Everybody's going to get sick. Intermittent outbreak is exactly what it means. Intermittent. Right? We have where we are exposed over a period of time. Because so people get sick at different times, such as food poisoning. So let's say a restaurant is serving lettuce, the same batch of lettuce, and it's serving it over 4 days. Everybody's going to get exposed that's eating the lettuce, but some may be on day 1, some may be on day 4. but they're all going to get sick eventually. And then a mixed outbreak is person to person. All right, so a mixed outbreak is like the flu. We pass the flu on to each other. Okay, and then a propagated outbreak typically doesn't have a common source, gradually spreads from person to person, right? TB is an excellent example of that. So I've given you 4 different types of outbreaks and 4 different examples. So then let's assume we need to teach the community about potential outbreaks. Okay, first thing we have to do is conduct a needs assessment. How do we know what we have to teach if we don't conduct a needs assessment? Right? And there's some stages for that. And they're listed here. We have the pre-active stage, the reactive stage, the inactive stage, and the interactive stage. And I've outlined right here what each of them are, right? During the pre-active, the nurse projects future needs. During reactive, we are determining the problem with what we've identified in the past as needs. And then the inactive stage defines the problem based on existing health status. I know this is all confusing, that's why I brought the notes up, so you could actually see it. And then the interactive stage describes a problem using past data to project future needs. When we talk about infectious diseases, we also, you can't skip over vaccines. Okay, vaccines are one of the most effective methods of preventing and controlling communicable diseases. One of the challenges I had as a school nurse was not convincing, but encouraging kids to be vaccinated. Okay, what do you do? What do you do if a parent simply refuses to vaccinate? You have to honor that and respect that. Okay, they have 3 different ways to refuse vaccines. They have medical exemptions by a physician. The student has a certain diagnosis, they cannot get the vaccines. You can do a religious exemption based on religious beliefs. And then you can also do a personal exemption, which simply means I don't want my child to be vaccinated. And that's perfectly fine. But the one thing you have to be able to do is try and educate the parent on the importance of vaccines. Okay, if they don't get their child vaccinated, there needs to be a plan in place in school for, let's say they don't get the rubella vaccine, or let's say they don't get the pertussis vaccine. What if there's an outbreak of pertussis in the schools, or in their daycare, or in their after child care? You as the community nurse and me as a school nurse had to have that discussion over and over again with parents. I couldn't be judgmental in why they chose not to get vaccinated, but I wanted to be proactive and come up with a plan with parents of what happens if the particular communicable disease happens.
Professor Marvel,
Yeah.
sorry. Is it true that in some states, like maybe California, that they don't have to be vaccinated to go to school? They're allowed that, or is all states required for them to be vaccinated to go to school?
My understanding is the federal law,
Okay.
and each state can write in their own exemptions.
I lived in California for 13 years, and all my kids had to have shots in order for them to attend school.
Yeah, it's called Shot to School or something. It's a federal law.
Yeah, I know in Florida we got to have all our shots.
Yeah. However, if you chose not to get your shots, you do exemptions. Exemptions are available for parents to do. Right? That's available, and every state determines what level of exemptions or what exemptions are available. In the last couple of years I was in school nursing, the health department, for parents who wanted to do an exemption, had to actually, through the CDC, the state health department, watch a video on why vaccines are safe. It wasn't to convince them, it was to educate them on making sure there is a plan if your child is in a building or a school or someplace that there's one of these communicable diseases is present. So every state will do things differently, but it is a federal law that students have to be vaccinated or exempted prior to going to school. Does that help, Charisse? All right, let's jump to HIV infection, hepatitis, TB, and STDs. Right, we know the STDs are a major challenge, major public health challenge in our country. Right, when we talk about STDs, we talk most commonly about gonorrhea, syphilis, chlamydia. Okay, most of STDs are bacterial. Right, they're cured with antibiotics or treated. Okay, but what happens if you have a viral STD? Can that be treated? No. It's symptom management, right? Let's say you get the flu. We know the flu is viral, so you get treated with Tamiflu. It's not an antibiotic. It's an antiviral that will hopefully help you not to get as sick. Okay, one of the biggest concerns about pregnancy is untreated syphilis, right? Because we know that untreated syphilis in pregnancy can be transmitted transplacentally, mom to baby, which will create lots and lots of potential problems. Okay, so have a look at chlamydia, syphilis. It's in your readings. Okay, just have an understanding of what each of them are. Are they bacterial or are they viral? How are they spread? Bacterial, treated with antibiotics. Okay, all sex partners for the last 60 days should be contacted, tested, and treated for chlamydia or gonorrhea. Symptoms can be asymptomatic. Also good with chlamydia can cause pelvic inflammatory disease, which leads to a whole set of potential problems. Syphilis begins as a painless sore. Have you gone through these particular STDs in any of your other classes? This is where your med surg is coming in, right? Herpes and genital herpes, viral, incurable. Clients with genital herpes should inform their partners of the disease to help prevent transmission. Okay, hepatitis. We know hepatitis is a viral illness that affects the liver, attacks the liver. And there's 3 different kinds of hepatitis. I want you to review those: hepatitis A, hepatitis B, and C. Okay, we know A is fecal oral. B is bloodborne. C is also bloodborne, but very high risk are your IV drug users, infants of infected mothers. 85% of people diagnosed with hepatitis C will develop chronic or lifelong infection. And we know that hepatitis B can hopefully be prevented by immunizations. What about HIV? What is HIV? Blood-borne infection spread through sexual contact, sharing of needles. This rationale was in your quiz question. So we actually have gone through what I wanted to talk about with HIV with regards to how it's spread.
Hello.
You still with on it?
Hello? Here's the testing. We talked about the testing. It can take up to 3 months. The other thing I want to mention about HIV here is HIV infected people who live near one another in close quarters, such as prisons, need to be carefully screened and deemed non-infectious before they're able to be admitted. Why do you think that is? Well, an HIV client is much more susceptible to opportunistic infections. And the most common of those opportunistic infections is TB. TB, what do we know about TB? Spread through airborne droplets. 95% of people, it becomes latent. Screening is done through, who hasn't had a TB screening test on their forearm? Right? You require those for employment. Okay? Bioterrorism and disaster. There's two types of disasters. There's a man-made and a natural. Give me some examples of a natural disaster.
Flood,
Blood, oh, we said the same thing.
flood,
What else?
storms like hail and
Hurricanes.
Hurricanes,
stuff
yeah,
like that.
yeah. Earthquakes,
Mm-hmm.
right? And then man-made disasters, on the other hand, are human created. Pollution, fires, pollution, warfare, water supply contamination, soil contamination. Okay. Couple things to know about, let's say you are the community nurse and you are teaching families how to prepare for a disaster. In yellow here is what you would teach them in putting together a disaster kit. Really important for the community nurse. Okay, there's 5 things. Stock enough food for 3 days. Review your kit every 6 months for expired items. Ensure all members in the family know where the kit is located. Make sure people know how to turn off their own utilities in the house. 4 things. 3 days, review the kit. Food for 3 days, review the kit every 6 months. Know where the kit is located and know how to turn off your utilities. And then also in disaster, we talk about mass casualty exercises in local communities. Okay, why do you think they do these? Why do you do mass casualty exercises? To evaluate the readiness, right?
Or preventative also, so when it does happen, we're able to deal with it at the time, like, loss
Is it-
prevention, kind of like.
Yeah, there's a communication chain of command, right? What's the response? All the responding agencies. There's a chance for everybody to get together who's going to be involved in a mass casualty exercise to see how they come together, how they communicate, how they respond. Okay. When disaster happens, we as nurses need to recognize that everybody is going to be in the impact stage, right? The impact stage is the most important, right? How do we get people to safety, to a central place, to safety, to get more information? Does that make sense? So impact stage is right at the beginning. We need to understand the impact of our actions during the impact phase. First and foremost, safety. We already talked about the exposure to toxic chemical. That was this paragraph here was one of your quiz questions. So we already went through that. Some bioterrorism agents to be aware of: anthrax, smallpox, and sarin. Okay, so anthrax. This is on your HESI prep. Okay, what is anthrax? They're cutaneous small sores that develop into skin ulcers with a black center. What might you observe? Somebody who's potentially been exposed to anthrax. GI issues, nausea, loss of appetite, diarrhea, fever. Respiratory is a big issue with the potential anthrax exposure. Okay, flu symptoms, chest pain, shortness of breath. Smallpox we talked about, flu-like symptoms, develops into a rash with red spots and becomes pustules, leaves craters. We went through smallpox in the quiz. Sarin. Sarin, when you're exposed to sarin, when teaching about exposure to sarin, what we know, they're going to experience a severe respiratory distress. That is the key with sarin exposure. Severe respiratory distress. And then think about foodborne illness, food safety when we're dealing with a disaster. Okay, we always know to wash our hands. Separate, well, this is more food, this is more back into the infectious disease. Foodborne illnesses, food safety. Here's some ideas of what we're going to teach. Washing hands, separate raw and cooked food, using separate equipment and utensils, thawing frozen food in the refrigerator, right? Not in the counter at room temperature, which I'm kind of guilty of. Cooking the food thoroughly, right? Not using food beyond its expiration date. The other issue we can have is waterborne illnesses. What if you have contaminated water and people are swimming in it? Maybe contaminated with animal or human fecal material. We always hear about, with disasters, we hear about cholera and giardia, right? That's contaminated water from contaminated water. The other thing that can happen with the disasters is vector-borne illnesses. Lyme disease, Zika virus, Rocky Mountain spotted fever, malaria. Because lots of different factors with disaster and bioterrorism. Okay. Questions on week 7. Let's jump into week 8 and talk about home care, community resources, case management. And I'm not really going to go through care of complex chronic illnesses because you had very specific reading in your med-surg book for each of these. So I want you to review that. This is where your med-surg information comes in. And there's several questions on the HESI prep. Well, there's several questions on the HESI that you'll see on your HESI prep. This is the true med-surg part of your HESI prep assignment for complex chronic illnesses. All right. So I want you to review that from your med-surg reading. We're not going to cover the care of complex chronic illnesses because you've already been covering those in other classes. And you can reread and update from your med-surg book. Home care. What is home care? Where are we providing care? Very specifically.
Home, a patient.
In the client's environment. Right? Yep. In the client's environment. The two things about home care, two most important factors. We're providing care in the client's environment, and it's individualized care. It's not to a group of people. It's individualized. Traditionally, home care has been thought of as homebound, but that's not necessarily true now. Okay, it's not just homebound, right? Home care includes visits by public health nurses for what maybe it's primary prevention, secondary prevention, tertiary interventions. Right? Home health nursing is really, really important, right? We may be providing training, education with new diagnoses, new meds, maybe a discharge from the hospital, and there's wound care or catheter care. Think of all the things we're doing in the client's environment, their own setting that used to only be done in the hospitals. Right? The goal of home care, the objective is to facilitate self-care, right? So that the clients can remain in their home, right? They have some control over their life and their new diagnosis or their new treatment plan, right? Increase their self-esteem, keeping them at home. Oftentimes, family members provide assistance to the home health nurses. But the whole goal is helping clients to help themselves. That's home care. And we always talk about the reason why a home health assessment takes so much longer than a hospital assessment. Well, in the home, you're their guest. Right? You have to get to know them, establish a relationship, understand the environment, doing lots of different risk assessments, environmental assessments, safety assessments, fall risks. You have to establish that trusting partner relationship. If you're going to be in and out of their home, there's a more specific level of relationship building that needs to take place than walking in and out of their room in the hospital. The other thing that's very important in home care is Medicare regulations. Medicare regulations direct a lot of the home care. And this is where we talked about one of the quiz questions, interdisciplinary collaboration. Okay. Medicare. Let's talk a little bit more about Medicare. Medicare and Medicaid are two separate federal programs. Medicare is for your 65 and older and anybody at any age disabled. Okay. Medicaid is needs-based. That's the primary difference. The other thing is in home care, Medicare will cover skilled nursing care, changing wounds or changing dressings, catheterization, IVs. They won't cover helping with activities of daily living. It has to be skilled nursing care. Okay. So bottom line about home health is we are able to provide so much more care to our clients in their homes than we ever used to be. Okay. Community resources. One of the things as a community nurse, you need to be knowledgeable about our community resources. Because every client you work with, every family you work with, every population you work with, everybody's going to have different resource needs. Okay, when I traveled around from school to school to school, I had a big notebook of resources, whether it be parents needing resources, kids needing resources, students needing resources, or teachers needing resources, from food banks to health fairs to volunteer organizations such as Meals on Wheels for the elderly Red Cross, crisis pregnancy centers, domestic violence abuse shelters, churches. What resources do they offer in your community? Transportation services, sitter services, right? You have to be knowledgeable about all the different resources available to your populations in the community. Okay, then you need to also be aware of your populations that are non-English speaking. How do you get the information about resources available to them? Well, we would access community leaders, right? That's that partners, those are those community partnerships. You know, let's say you have a large Hispanic population and you don't speak the language. Who works with these? Who works with these groups of people in the community? Who can you tap to get information to them? I used to have to tap into different people at the health department that spoke different languages or had printed materials in different languages about vaccinations. So you have to tap into your community resource leaders that are working with these populations. Okay. It's the only thing I want to say about community resources. Next, and I think this is our last topic, is case management. What is a case manager? What's case management and what does a case manager do?
They help you with resources between like you leaving from the hospital, going home. They get services for you like physical therapy, PT, OT,
Mhm.
things like that.
Mm-hmm. They're the coordinators of care. And there are case managers located everywhere. There are case managers in hospitals. There's case managers in insurance companies. There's case managers in large employers. It's the coordination of care. And typically not every client is case managed or every family is case managed. It's the high cost, high resource using clients. A lot of elderly patients are case managed. Okay. Our very high impacted kids in schools are case managed, right? Because they need a lot of resources. Okay. We know that case management can be labor intensive, time consuming, and costly. Okay, because of the number of clients with complex problems, nurse caseloads for case management are extremely high. Okay, but you can't case manage everybody, although you'd like to. Okay, one of the problems is fragmentation of services, right? Because there's so many complex chronic issues, right? Okay, the only other thing I want to talk about is communication. Case management requires varied types of communication. And there's a difference. Okay? Requires collaboration, assertiveness, cooperation, and compromising. Let's talk about these four. Because think about everything you're doing as a case manager. You may be negotiating insurance rates with insurance companies. You may be negotiating prices for medical device rentals, right? Oxygen. You may be having to talk with pharmaceutical companies about certain medications that may not be covered in their insurance. Okay. It's not simply setting up a PT appointment or setting up cardiac rehab. You're having to deal, if you're case managing a client, you're dealing with everything. Who's helping them in the home? Where are they transitioning to? What needs to get done? What services need to be coordinated? What is the insurance going to cover? What is going to be the patient cost? Case management's a very involved role. Okay, so you might be collaborating, right? You're working with others towards a solution that satisfies the needs of both parties, right? Collaborating. Okay? Assertiveness. You might have to be assertive as a case manager, where you're presenting your client's needs, right? The best example I heard somebody explain is a nurse having to talk to an insurance company of somebody that was diagnosed with a rare form of cancer, but their insurance company doesn't cover this particular drug. However, the case manager has determined that if the patient doesn't receive this drug, they're going to end up in the hospital long term, which will be much more expensive than just providing the drug. Okay, that's an example of trying to be assertive. Cooperation is the ability to understand and meet the needs of others. So you're trying to cooperate. And then compromising, you come to some agreement and everybody's partly happy, right? That's compromising. It's acceptable. It's not ideal, but it's acceptable to both parties. Okay. And then the last section was the complex chronic illnesses. I do want to cover the very beginning part of that, but then I want you to review cirrhosis, COPD, diabetes, peripheral artery disease, CVI, chronic venous insufficiency, and hypertension. Okay. And hopefully it's a review. Hopefully you've read it and it's a review. But let's talk about post-op care for a minute. Okay. And the chronic complex illnesses. What's the most important things we think about? Okay. Airway, breathing, ABCs, safety, pain, potential complications. What assessments do we need to do? Right? When we're looking at airway and breathing, are they at risk for lung collapses, atelectasis, pneumonia, PEs, pain, depression, respiratory depression from pain medication, from anesthesia. When we're doing assessments of circulation, are they at risk for DVTs? Are they at risk for sepsis, dehydration due to their poor intake in the post-op period? Are they at risk for urinary tract infections due to a catheter? Skin wound healing. Are they at risk for infection? At risk for pressure ulcers? Assessing their pain. Assessing the nausea due to maybe medications or anesthesia. Or are they experiencing constipation due to the pain meds? Okay. So how do we prevent complications? Aseptic technique, we talked about that. Changing dressings, turning and coughing and deep breathing, right? Incentive spirometry, encouraging oral intake, pain control. Ice chips, maybe heparin injections. Compression stockings to lower extremities. Laxatives if needed for constipation. Okay. And I want to mention one more thing about delegation during the post-op period. Okay, if you're delegating to a UAP, you need to provide, I have this highlighted in yellow, you need to provide specific instructions. What's to be done? How is it supposed to be done? What needs to be reported back to you? right? You can't delegate without explaining what to do and how to do it. Okay, and then of course you would never assign an unstable client to a UAP, right? So that's our 2 weeks of content. That's a lot of information, I know. But the week 8 is where heavily med-surg. So on your HESI prep assignment, you need to go into your med-surg book, into the readings that are assigned to you. And the answers to those boxes in your HESI prep are in that reading for those chronic. I know probably when everybody read that at first, they're going, well, this doesn't have anything to do with community. Yes, it does. Complex chronic illnesses do. You may be caring for a client in the hospital with acute cirrhosis, but then they go home. Caring for a client with peripheral artery disease in the hospital. They've had an episode or an event that's been exacerbated. They're going to go home. You're going to care for them in the home with the same diagnosis. These chronic complex diseases aren't going away. So the reason why these are presented to you in this class is because you'll be caring for clients both, well, this class is about the community, but it's transitioning the care of these complex chronic illnesses from the acute care setting into the home. It's one of our biggest issues, and not biggest issues, one of our biggest expenses in our whole American healthcare system is the care of chronic diseases. People aren't going to stay in the hospital. You're going to be caring for them in the home or in the community. Long-term care, rehab, assisted care, memory care, urgent care, medical office buildings, dialysis centers, hospice centers. These are people with chronic diseases. Okay? Questions? Helpful information?
Yeah, will you send this to us, the blueprint? Did you
Nope.
just,
Those are my teaching notes.
oh,
I
okay.
can't, no. That's why I brought them up so you could take notes from them. If you need to go back and watch the recording, that's fine. Take notes from those. But there was so much information, I just wanted to bring those notes up. Okay, so hopefully you're taking notes.
Yeah, that's gonna be very helpful.
Okay, good, good. I'm glad. I do have a chat. Hang on, make sure I don't have to. Brittany, you didn't see your rationales? Where's Brittany? Where's
Yeah, when I finish my quiz, it says it's locked.
Mine
ration-
too. I can't go back and look at my quiz
Yeah.
at all.
wait. You can't go back and look at it.
Nope.
Okay. Did you see the rationales as we were going through, or once you submitted it?
Once I submitted, I can't see anything else.
Yeah,
Like it just
only
has that
what you put
little.
up is what I could see.
Say
Yep.
that again, Brittany?
Only what you put up is what I
Oh,
could
okay.
see. So when you were
So-
reviewing it, that's it.
Is that different from the other quizzes?
Yeah,
You're able to go back.
yeah.
All right, hang on a second. Let me look real quick because I want to make sure that. Let's see. Quizzes, time limit. Oh, lock questions after answering. Let me undo that. Let's see if that helps. I don't know why that's checked. All right, go back. Will you just go back and look and see if you can see them? No, refresh it.
I can't see it still. Can anyone
still-
else see it?
Pardon me? You still can't see
I
it?
can't see it still. It still says locked. It was locked at 12:30 p.m. It says.
Yeah, you know,
Yeah,
I'm,
mine is still can't see it either. It says correct answers are hidden, and that's all it says.
okay, let me, let's see. What details? Where is? All right, let me go in here and see if I can. So I want to make sure you have access to that. 1 second. Preview. Okay. Try this. Quiz restrictions, we got that. Where's my times? That's what I'm looking for. Because I want to. Okay, I'm gonna have to work on this and figure out. I know I closed it at 12 or 3:30, but all right, I'm gonna have to work on that. Okay. Because I don't know why. You can see the rest of all your other quizzes, right?
Yes,
You can go
ma'am.
back and look at all your other quizzes.
Yeah.
All right, I'm gonna have to work on that. Okay, I'll work on that. And I'll send you a message when I do. I'll send the recording this evening of the class. So if you want to go back and take notes from the notes that I had, you're more than welcome to. Okay. Any questions, Sharice?
You have a few minutes to meet after class.
Yep. Yep. Okay, nobody has any questions? Let's see.
Are you gonna do a HESI review yourself anytime?
Yeah, they're in, you got the master schedule on the exam
Mhm.
reviews. It's also has HESI reviews on there.
Okay.
Yep, and those will be done in week 10.
Okay.
There should be 3. There's each Professor Kershaw, Professor Ford, and myself all do. And I think that will be in your week 9 announcement this upcoming weekend that goes through what's going on in week 9, 10, 11, and 12. But yes,
Okay,
we do
thank you.
HESI reviews. It's on that master calendar.
Okay.
All right. I hope everybody has a good rest of the week. Reach out if you need anything. If you did score below a 78 on the exam, if you could reach out to me with a day and time to go through the concepts you struggle with, I would appreciate that. Okay. But everybody have a good week.
Bye.
Thank you.
You're welcome.